All right, hello everyone, and welcome back. If you're studying for your Certified Personal Trainer's exam, this video is going to help you along the way. Today, we're diving into Chapter 8, which is all about cardio training. We learn about physiology, assessments, and programming. Let's get into it. Starting with the basics, it's important to understand that the cardiovascular system is a closed-loop system made up of the heart, blood vessels, and blood. It's important to understand how this system works together. First, arteries are carrying oxygen-rich blood away from the heart. Capillaries are where oxygen and nutrients get exchanged, and then veins bring the oxygen-poor blood back. The second key system is the respiratory system, which brings oxygen into the body. It is made up of the nose, nasal cavity, pharynx, larynx, trachea, bronchi, and lungs. When you combine your cardiovascular system and your respiratory system, you get your cardiorespiratory fitness levels. And this is really your ability to deliver oxygen to working muscles during your exercise. There are three key processes that are important to understand when learning about cardio performance. The first is oxygen carrying, which is the process of getting oxygen into the blood. The second is oxygen delivery, the process of getting oxygen to the muscles via blood flow. This is really one of the most important processes in determining cardio performance. And the third is oxygen extraction, which is the process of muscles pulling oxygen out to produce ATP. As mentioned, the most important process for determining your cardio fitness levels is oxygen delivery. Oxygen delivery depends on cardiac output, which is heart rate multiplied by the stroke volume. At rest, cardiac output is around 5 liters per minute. And at max exercise, it can increase up to 20 to 25 liters per minute. In even higher trained adults, it can be much higher as well. Think about it like this. The more blood your heart is able to pump out, the more oxygen gets delivered to your working muscles. That really just leads to better performance in athletes. It's also very important that you understand VO2 max and the ventilatory thresholds. VO2 max is the maximum oxygen you can use per minute per kilogram of body weight. It's really the gold standard for determining cardio fitness. One key piece of information that it's important for you to know is that your VO2 max improves in the first 6 months of exercise, and then it relatively plateaus. Your ventilatory thresholds are where things shift from aerobic to anaerobic. In other words, where your body goes from using oxygen as its main fuel source to using glycogen and glucose. When training clients, this could be easily measured using a simple talk test. At the VT1, your client is producing easy to moderate effort levels in any sort of cardio fitness test. Still talk comfortably while exercising at this threshold level. Conversely, at the VT2, this is going to be a much harder effort, and in a talk test, it's going to be much more difficult for your client to respond to questions that you're asking them or for them to form full sentences. This is how you know that your client switched from aerobic to anaerobic. Understanding the training zones will give you a comprehensive understanding of how to build a cardio plan to help improve your client's fitness levels. Starting with zone 1, this is an easy exercise zone, anything below that ventilatory threshold 1, where your client can sustain an easy conversation. Think about it as to work out in this level for an hour plus. Zone 2 is more moderate. It's between the ventilatory threshold 1 and the ventilatory threshold 2. And then zone 3 is considered hard. It is anything above or at the ventilatory threshold 2. This is where they're using glucose and glycogen for energy production, and they really can't sustain this for longer than a few seconds. Putting this into practice, when you're building your client's training plan, you should think about them spending most of their time in zone 1. This could be up to 70 to 80% of their training plan. This is because zone 1 allows them to continue to build their aerobic fitness, really helping them improve their body's ability to deliver oxygen to working muscles. Conversely, very little time should be spent in zone 2. Zone 2 is considered by many experts to be the black hole of training, really because you're working too hard to allow your body to recover, but you're not working hard enough to really be building that cardio performance fitness levels. Lastly, you should be incorporating short bursts in zone 3, really allowing your clients to push their bodies and improve their overall VO2 max. You can use the FIT VP formula when thinking about programming for your clients. Thinking about the frequency, intensity, time, type, volume, and progression will allow you to build a really strong program for your clients to help them overall perform their cardio. It's important to understand that the majority of Americans do not meet the recommended health guidelines for movement. The recommended health guidelines are 150 to 300 minutes of moderate exercise per week or 75 to 150 minutes of vigorous exercise per week. You can use these guidelines while building your clients' training plans. Understanding your client's current fitness levels will help you build a smart and safe training plan to best fit their fitness goals. Clients that are relatively untrained will likely start in the base training, where you're really only doing 10 to 15 minutes of zone 1 training 3 times a week. This will help your clients build up their fitness level slowly and safely to maintain their motivation throughout the training plan. From there, clients will progress to the fitness training zone. This is still going to be mostly zone 1 training, but from there you're adding in longer workouts and potentially some increased intensity with some intervals. Lastly, clients will progress to the performance training zone if that's what they're looking for in their training plan, where you're still doing 70 to 80% of zone 1, but you're also adding in that higher intensity zone 3 training. Again, minimal time in zone 2 because this is really going to build the fatigue without seeing the optimal adaptations. When you're building workouts for your clients, it's always important to remember the warm-up and the cool down. This could be 5 to 10 minutes of zone 1 training where your heart rate is going to be lower than 120 beats per minute. From there, it's great to add in some intervals, which could be done at a 1:1 to 1:3 ratio. It's good to know that when scheduling intervals, short 30-second intervals can be just as effective as longer ones. So thinking about this will help you build a really smart plan for your clients. When studying the exam, it's important to understand a few key conditions that impact cardio performance. The first condition is arteriosclerosis. This is the condition of hardening and narrowing of the arteries due to plaque accumulation. This is mostly common in older adults and leads to higher blood pressure. The second is asthma, a chronic inflammatory disorder of the airways that affects genetically susceptible individuals in response to environmental triggers such as the cold, allergens, viral infections, exercise, and stress. The third key term is emphysema, which is the gradual destruction of lung alveoli in addition to airway inflammation, which leads to the reduced ability for someone to inhale and exhale. The last two conditions are anemia, which is a low red blood cell number, and ischemia, which is a reduced blood flow to the heart. This is because of a narrowed coronary artery. Ensuring exercise safety is your number one priority as a personal trainer. If your clients are exhibiting any of these symptoms, please have them stop exercising and refer them out to a doctor. This is something that likely will come up on an exam, so it's important to have an understanding of these signs. The last key concepts in this chapter are understanding the body's adaptations to training. The acute adaptations, which are the adaptations during exercise, are an increase in heart rate, an increase in breathing, and an increase in oxygen use. This is something you've likely experienced as you've exercised. The body's chronic or long-term adaptations to training is really how you're able to improve your fitness levels over time. Your body will naturally increase the mitochondria, increase the capillary density, the stroke volume, and the cardiac output. So with continued training, your client will see dramatic improvements over time. So to wrap it up, it's important for you to understand these key concepts from Chapter 8. We went over oxygen delivery, VO2 max and thresholds, different training zones, the FIT VP programming guidelines, and the body's adaptations to training. Thanks so much for watching.